Hey everybody, welcome to tonight's live. I'm Dr. Tammy, and every night I come here at 7 and we talk all things menopause. And this month we are doing the 25 Advent days until Christmas. And I can't believe it's almost Christmas. So we are almost halfway through the list. A lot of people think that with menopause, the number one symptom is hot flashes, but it is not. Hot flashes is like number 7 on the list. And so number 1 is, and I almost want to do that countdown song, where the 7 days of Christmas, 5 golden rings, that one. So I'm not going to sing for you, I promise. But number 1 is fatigue. Number 2 is not sleeping. Number 3 is weight gain. And then all the way down to number 7, which is hot flashes. So we went past hot flashes, and now we are to joint pain and menopause or perimenopause. One of the things that a lot of people aren't familiar with a menopause symptom, which all of these symptoms, most people are like, I had no idea that was related to menopause. But one of the main things that can happen that people don't know about is frozen shoulder. So I'm going to kind of pause just a little bit. I know there's a lot of people coming on right now. And if you've ever experienced frozen shoulder, would you put that in the comments just so I know how many people have experienced that so I can kind of address that and you can ask me some specific questions. And I think that my camera is a little bit fuzzy, so I just wiped that off a little bit. Probably because it's been in my back pocket and my purse and all the places, all the places that our cameras, our phones go. So they get a little bit gummy sometimes. But so, yeah, so I'm going to let you guys comment. Has anybody experienced perimenopause, menopause joint pain, or specifically frozen shoulder, knee pain? Is toenail fungus dangerous if not removed? Okay, that's a little off topic, but since nobody's really chimed in yet, I'll go ahead and answer that. Um, not necessarily, no, but that's also an indicator. I call things like that the canary in the coal mine. If you've got fungus in a toenail, you've probably got some sort of fungal infection systemic. And so that's something that usually you want to work with some sort of functional medicine doctor to get rid of that because there are all sorts of different things that can be systemic. So just the toenail itself, yeah, they look yucky and they can fall off, but there's a lot of different treatments you can do for that. Natural treatments. Usually I find in my practice, we end up doing the systemic medication, which is like the Lamisil, but it can be a little hard on the liver. So it does have to be monitored. And, my bigger idea with that is that we're treating the underlying fungal infection. I'm not just going because for cosmetics, although nobody wants an ugly toenail, right? Yeah, if you guys are having fun here and you're liking the information, if you could tap this screen and just send me some hearts because that really helps the algorithm get more out there. Why are there female hormone questions on my internal medicine boards? Why are there female hormone questions on my internal medicine boards? I'm not sure the answer to that. Are you saying that internal medicine doctors shouldn't know about hormones? Because that's kind of basic science, right? Oh, I'm just complaining. Okay. I totally get that. Yeah, all the things, you know, med school, residency, I get it. Yeah, if you want to vent a little bit, that's okay. Because it is a lot. It is a lot to take care of patients. It's a lot to know. I remember in my residency, it was crazy because I was so overwhelmed. And I actually had one of my attendings say to me one time, Tammy, don't worry about it. Just memorize a few drugs, a few medications, and you'll make a good living. And to me, that wasn't enough. That at first it was kind of like relieving because it was like, okay, because I knew there was so much information to know and absorb. But it also was just like sad that it speaks to the condition of our current medical, system because it's like, no, there's so much more to it than that. And I think that is classic. You know what? I'm assuming that was a medical doctor that just came on because he said internal medicine boards. But I think that's so classic that And I'm glad that happened actually, because that so speaks to the lack of knowledge. And if you are a woman, a menopausal woman, would you please just chime in and say, "That's awful"? Like, please just go in the comments and say, "An internal medicine doctor really didn't know about hormones, or they were complaining." How can you complain about helping menopausal women? And I see that all the time, that most traditional doctors are not trained in hormones. They're not trained in, which is crazy, because what internal medicine doctor wouldn't say they don't understand thyroid? And thyroid is a hormone, right? So that's what we're dealing with. Yeah, it's really sad. It is. So that is what we're dealing with, is doctors who think that hormones are all estrogen, because that's what they're saying, and that we are a nuisance to them. We are a problem on their medical boards when they have to take their test. I'm 46, I'm having all the symptoms, so I'm probably in peri, right? Okay. So, well, I'll kind of explain that a little bit. I'll get off my rant about medical doctors making me mad about like not understanding women, and that's probably I mean, it's they're not taught in med school. So I'll get off that rant just a little bit, because big pharma rules the roost with that, and they are just trying to get people on drugs. And so understanding, or having someone who really understands menopause is hard to find. So anyway, that's kind of where we are. So 46. So with perimenopause, usually that just means that you are still having menstrual cycles. So I'm going to draw a little picture, but I'm going to have to flip my screen before I do that. I think I'm mirrored. So you guys will have to comment and tell me if you can see this okay. Okay, so I'm going to draw my usual. Let's see, I'll move that just a little bit. Okay. Can you see that? Do I need to flip it? My moderator can tell me. Let me see. I'll write the word here. I think it's got to be flipped. Does it need to be flipped? It's good? Okay, cool. So if we draw this graph, and on this axis is hormones, and okay, thanks, Christine. I appreciate it. So on this axis is hormones, and let's say this is birth, baby girl, of course, and all the way out here is 100. It is backwards? Are you sure? Let's try to switch that and see. Yeah, I think it was backwards. Is that better? Okay, cool. Okay, so if we put hormones here and then we birth to 100, right? Okay, and then halfway, let's put, yeah, cool. Let's put 50. And that is about the age that menopause happens. So I'm going to put menopause here. I love to draw pictures if you haven't guessed yet. Okay, and then what happens is, let me use a different color here. I'm just going to say, like most doctors think that all hormones are estrogen, and I'm going to use red for estrogen, because estrogen usually is the part of the menstrual cycle that causes you to build up a uterine lining and bleed. So I'm going to use red. Okay. So at birth, we start building up an estrogen level, and all these hormones are actually all the ovarian hormones: estrogen, progesterone, testosterone. And at birth, we start building up our estrogen levels. Okay. And then what happens is we have periods, and the estrogen waxes and wanes every 28 days. And then maybe we have a baby, and then it really fluctuates. And then maybe you have endometriosis, PCOS, any kind of uterine bleeding or any kind of problems, ovarian cysts, and then it might go like this. But anyway, it starts kind of getting really erratic. And so what I'm going to do here is I'm going to outline what perimenopause is, because some people wonder that. So let me just say that the word, oh, Constantina says I ordered my kit. Yay, I'm so excited. She's talking about the Hormone Bliss test kit, and we check estrogen, progesterone, and testosterone levels so we can see where you're at. And a lot of people have a hard time finding a doctor, and yet, have a hard time finding a doctor who will listen to them. First of all, they're probably like, those internal medicine doctors are like, hormones are a nuisance, women are a nuisance. Um, and then, just having somebody to do the testing and then someone to listen to you and do treatment. So we do all of that. So this is our test kit. I'll just kind of show what that looks like. And for the month of December, we are running a special. You're changing my spelling. Yay. Okay, cool. That's why I'm asking you. Okay, yeah. So we'll do perimenopause. This is fun. So yeah, for the month of December, it is 119 and it's normally a $300 test. So it's our little Christmas present to you to get your hormones checked. So if you have problems finding that doctor who will check and listen. And then we also include a free consult and you get on with one of our hormone experts that I personally have trained in all my protocols. And they will tell you what's going on and then make you a plan, usually BHRT. It could be supplements. It could be coaching, whatever the case may be. But we get you back on track. And I always say, my commitment to every single one of you and my patients in my practice is that I always guarantee that we will get you feeling better. I had to straighten that up a little. That we'll always get you feeling better. But the commitment goes both ways. So you have to stay committed to the process because every single person is different. Marmy says mailing in. I am tomorrow. Yay! I'm so excited. And it doesn't take very long. Once the lab gets it, they run it pretty quick. So we're just looking at 2 or 3 days in the mail. And then we notify you when the results are in. So I'm so excited to get you feeling better because literally, if you get in our program, you could be on hormones. We're getting pretty close to Christmas, but we could have you feeling better by Christmas, which would be awesome. So anyway, yeah, I had to kind of jump on the test kit because she was saying she got a kid. So I'm so excited. And it is just going nuts because so many women want this. So many women need this. So many women aren't being listened to. So it's just so awesome that we have this. And it's my passion project. And I'm super excited that we get to do this. And Elaine says, good evening, everyone. Hello, Elaine. I'm so grateful you're here every night. I just love you. I feel like you're an old friend. Like you just show up. And I know if nobody else shows up, Elaine will be here. Let's see. When you start hormone therapy, are there any side effects? Well, starting hormone therapy is a balancing act. And I have a book. It's on Amazon called Balancing Act, appropriately. And it is a balancing act, and everybody's different. And usually, I've been doing this almost 25 years. Usually, I'll get it pretty close right out of the gate. We might have a little fluctuation if you still have a uterus. Sometimes we'll have a little uterine bleeding, or we'll have, just things come up, right? But we're doing it with safe bioidentical hormones. We're doing it in a topical route, and we do it working with you and individualizing it to you because, yeah, it can be a balancing act. So I just ask everybody to stay the course and get feeling better and educate yourself. That's one of the biggest things. I stay dehydrated. I'm worried about the spit test. Okay, so I got to tell you, Bam Beauty says, awesome. I got to tell you that I kind of cheated a little the couple of times I've done my spit test. If you absolutely can't do it, because some people have just a little bit of trouble spitting. Oh, Elaine, I know. I love that. I love that you love that. I love learning too. If you have trouble spitting, and what they're talking about is in the test kit, there's a tube, and basically you spit in this tube. So if you're a little dehydrated, that is a little problem. Sometimes I tell people, think about a lemon or get a lemon and smell it, and that'll make you start salivating a little, or something strong smelling. But I'll tell you, I cheat a little bit when I do the saliva test, and I will drink a little water. So it's okay. Drink a little water when you wake up. And then I think you'll get that saliva going a little bit better because the test kit says totally dry, but it's okay. Drink a little water and then wait 2 or 3 minutes and then you can start spitting. And it's still effective. The lab can still run it. So I do get it. And it will take about 5 or 10 minutes probably to fill it. So it's not that easy. But here's the deal. If you do this and you just feel like you just can't, call our company. Our phone number is on the website Hormone Bliss, and let them know, and we will send you a blood spot test. So it's still at home, but it's blood, or we can send you a urine test. The reason we do the saliva is because for consistency, we do the topical creams. So when we get you on a topical cream, then the saliva is a little bit more accurate because it shows us what's going on in the cell, not just in the bloodstream, right? So I love this. And for the consistency, this is the test we do. And it's so simple. And some people don't like needles and they don't even like sticking their finger. I hate sticking my finger. I would rather get my blood drawn by a needle than sticking my finger because it's just, just hate it, hate it, hate it. So yeah. Oh, you're so welcome. Bim a Beauty. I'm trying to think what your name might be because I like Bama. So it might be your last name or something. But thank you, Bama Beauty, for saying that. Okay. So I'm going to go back to the perimenopause question because I get that a lot. And actually, our topic for tonight, I promise I'm going to get to it. I just get so passionate about all this stuff. And people like Elaine who come all the time, you probably have heard this a million times. But you know, it's funny because I have patients who've been my patients for 10 years or more, and they still, unfortunately, will go out in the world and they will have someone say, "You're on hormones? What? That causes cancer." And I have to talk them off the ledge, and we have to do the education. First of all, you're on organic bioidentical hormones. Safety profile is not only ridiculously safe. I can't even say that. I mean, it's so much more protective and life-saving and life-changing than ever any risk, but nothing is without risk, right? So I'll also show you why the risk, but the risk is not from the hormones. The risk is from not having the hormones and not having the right balance of hormones. So that's why it's really important that you work with somebody that knows what they're doing, who writes the protocols and teaches our experts to work with you based on almost 25 years of experience, right? And personal experience. I mean, I've had endometriosis, PCOS, everything that you can name. So, oh, Bambi said, I've ordered my kit. Yay. Thank you. I love that. I love that. Love that. Just makes me happy. If you guys have ordered a kit, tap the screen. Show me some love with the heart. So I know, so I'll see who else out there that's had some experience ordering the kits, or if you have any comments about the saliva, increasing your saliva, you can let me know that too. Okay. So yeah, so we're talking about joint pain, frozen shoulder, little known things about why joints hurt with menopause. But I want to finish the perimenopause question. So I was skipping around here just a little bit. So we did go with the estrogen here. And so we're having all this estrogen, bleeding, periods, all the things. And then perimenopause is, let's see, what color do I want to do for that? I'll do green. So we get to do arts and crafts tonight. So if this is age 50, let's put age 40 here. And then maybe 45 here. So menopause usually happens 40, 45, somewhere in there. So when you asked me, I'm 46, does that mean I'm perimenopause or in menopause now? So what happens is I'm going to do green for progesterone. So we just did red for estrogen, right? And so progesterone is also kind of dancing the dance and making estrogen behave. And then all of a sudden, you are born with all the eggs you're ever going to have in your ovaries. And once they dry up, your ovaries literally fail. So I always say the problem is not menopause. The definition of menopause is just a year without periods. The problem is that your ovaries shut down, they retire, they fail. So we are dealing with ovarian failure. And I can't not get passionate about when I say that word. So please, you guys, don't say menopause anymore, although I say it a lot, I know, because people have to kind of have something to relate to. Say ovarian failure, because that's what we're dealing with, just like if your thyroid went up. Do you do prescription out of state? So I can only practice within Arkansas. So you are welcome to come see me in Arkansas. But our program, our experts can work with anybody in the whole US. So yeah, you have to travel to Arkansas if you're not in Arkansas. And if you want just testing, we can do that home. We send the test to you. You don't have to go to a doctor's office. And we work with you and coach you and get you on bioidentical hormone creams. And if it comes down that we need to do thyroid or something like that, then it gets a little more complicated and we can still work with you. But absolutely, our program, I had to find a way to clone myself and to be able to work throughout the whole US. So I'm super excited. We can't go outside the US just yet. I'm hoping for that because I have several friends actually who are in other countries and they're like, we don't have any help here. And I'm just so sad that other countries are like so behind this. At least we have some people here. Christine said, this is so great to learn. I'm still having my period, but it's different, heavy, short, and cramps. Okay. So I actually talked a lot about this on the live last night, and I don't know if I reposted the replay. I think I did, but I go through all this nerdy science too. So I'm going to address that with the changes in the menstrual cycle. So let me try to kind of wrap this up and address that too. So, okay, so progesterone's grabbing onto the estrogen, making it behave so that you don't have heavy menstrual cycles. And that's what last night's talk was, a heavy menstrual cycles and irregular bleeding. So what happens is now around the age of 40, 45 to 50, up to 15 years before your ovaries shut down, progesterone is the first thing that starts to fail because it is the most sensitive to the ovarian internal combustion, if you will. So progesterone starts to drop here. And this is where you start to have the symptoms of no progesterone. And this is where most of the frozen shoulder happens. And I know people are like, what's frozen shoulder? If you haven't had it, if you have, please put it in the comments, or if you're experiencing a lot of joint pain, because it's all kind of similar. Frozen shoulder is just kind of a unique thing because the water in the capsule that lubricates basically and keeps it supported and cushioned dries up, because everything dries up when our hormones start to dry up. People don't understand that. Oh, Christine has joint pain. Okay, we got to fix that. But everything dries up. Our skin dries up, our bones dry up, our heart, our vessels, our brain, everything. Literally, I just think of like the Sahara Desert. We dry up. So it's just really important to have this hormonal influence. And progesterone is a natural anti-inflammatory, and progesterone is your main sleep hormone. So the word progesterone means progestation. Gestation means pregnancy. So if you've ever had a baby before, been pregnant, you know during that second trimester when that progesterone is super, super high, that you're extremely tired because it promotes that, sleep, and it's good sleep. I remember when I had my son, I would come home from work and see patients all day in clinic. And then, like, literally, as soon as I walked in the door at 5 o'clock, I would go lay down. My mom, like, my mom stayed over a lot and she's a big part of it's always been a big part of my life. And I just look at her and I'd be like, I gotta go to bed. I'll see you later. I mean, I just felt like I was drugged or something, it was awful. So, anyway, my point being, progesterone is wonderful for sleep. So what happens when the progesterone starts to drop? We get inflammation because it's an anti-inflammatory. We're not sleeping. And when you're not sleeping, things are worse too. So you just hurt all over. I mean, when I don't sleep well, I feel like everything hurts. I just like Tin Man when I get out of bed. I'm so, sluggish. And so then basically when the ovaries dry up, there's no feedback loop with the brain to maintain the hormones. And so it just bottoms out. So this is ovarian failure. This is a big deal. This is why women suffer. This is why we feel like we're in the grave before we're in the grave. And if you live to be 100 out here, this is ovarian failure till we die. And this is a big deal. And that's why I preach this so much. Jane said, how much should a healthy 68-year-old woman take? How much hormones? I'm not sure what that means exactly, but okay. So if you'll elaborate on that a little bit more, Jane, I'll see where we can go with that, because that's kind of a broad question. Okay, so then the next thing that happens after progesterone declines is estrogen declines, and estrogen is the thing that keeps us from drying up. Oh, okay. Progesterone, and then Don said my entire body hurts. Yeah, and that's just because the inflammation, no progesterone. And I'm also going to show you another connection with the hormones here in just a minute. that has to do with cortisol, which is your body's natural cortisone shot to you, or anti-inflammatory. So how much progesterone? It just depends, and that's why I like to do testing, which is our test kits. I don't need to keep pushing the test kits, but like it's I can't believe there are doctors who are like, you don't need a test. And that's just sort of what we're dealing with. We have these people out there saying you don't need a test. Well, how could you dose somebody's thyroid if they had a thyroid problem and you didn't know what their levels were? That's just nuts. And it's crazy because, like, there are so many medications that doctors just throw at people as Band-Aids, and they're not checking anything. They're just like, "Here's a drug, here's a drug." So, the wonderful thing about hormones is you can test it. And for doctors to say, you don't need a test, it's because they don't know what to do with it. And I always tell people, you wouldn't get a test if you didn't have something you were going to do with it, right? You wouldn't get an MRI of your back if you had back pain if you didn't know what you were going to, if you weren't intending on getting a procedure or surgery or something like that, wouldn't make sense, just for your information. Missy said, yes, my doctor, exactly. It's gross. It's just downright disgusting. And there is such an agenda to to keep us sick and to keep us not feeling good. And I'm telling you, I am 55 years old. I feel amazing. Now, I do have my days and I do get stressed and I do have days when I don't sleep great, right? And then I just stick a melatonin patch on, or I have so many supplements. I mean, just so much. Um, but yeah, so I get tired, I get achy, I have my bad days too, but for the most part, I feel amazing. Missy said, "Doctor pushes pellets." Yeah, a lot of them do, and they don't even test. Oh my gosh, I've had so many women tell me, "I went to this clinic for hormones because I heard they were good, and all they did was shove pellets in me." Oh my gosh, that is so dangerous, and I've had to actually remove pellets from women who were overdosed with testosterone, so, um, I'm 55 too, dealing with insomnia for 2 years. Yeah, Missy, if you're not on anything, it is awful, and it's not fair, and it's criminal. So, we would love to help you. If my moderator will pop in the link in there too, it's hormonebliss.com. And actually, we have another link that's my amazing, nerdy computer person, web designer put in, and it's hormonebliss.com. Get the kit. And I think that's kind of cute. So you can go directly there and order it too. So I think it's really important. Yeah, overdose with testosterone. It's awful. I mean, any hormone that's not in harmony, in the balance, I mean, and that's why you have to do testing, because there's progesterone, there's estrogen, and if they don't have you on progesterone with the testosterone pellets, that's awful. So I wanted to answer the question about how much progesterone. So when I'm testing, I will look and see how much they need. But sometimes in my practice, I will actually use an oral progesterone because the molecule is large enough that it doesn't affect the liver. So that usually comes in 100 or 200 milligrams. And in the topical creams, which are the safest form because they don't go through the liver for the metabolism. And I am so excited. I'm skipping around here a little bit now again too, but I just was working with my editor tonight on my new book that's coming out called The Menopause Metabolism Reset. It is amazing. I'm not bragging. I'm amazing. It's amazing because the science behind how your liver processes hormones and how it affects the metabolism with weight gain and just yeah, it's nuts. And so I had so much fun writing it, not because of the problems that people have, but because of the solutions that it can provide. So Lane said was 40 years old. Um, I missed what was before, Lane. 40 years old with perimenopause, maybe. I'm gonna guess that. You can come back. You can come back and tell me, Elaine. I'm not sure what you meant by that. I got a little scatterbrain. That's on me. Missy said, I did have an awful experience. Put me on 800 milligrams and it caused the cortisol steal and then more. 800 milligrams of of testosterone or progesterone? Wow. I mean, either way, that's a lot. That's probably the testosterone. I'm not sure. Yeah, let me see if you could tell me. Insomnia. Yeah, anything imbalanced, like progesterone helps with sleep, but too much progesterone. Oh my gosh, 800 milligrams of progesterone, that is nuts. Wow. Okay. So, I mean, that just speaks to the mismanagement. And I'm really not trying to dog my doctor colleagues. They are not taught about ovarian failure. And in fact, most of the doctors in my town tomorrow, if I went and said, how do you treat ovarian failure? They'd be like, what are you talking about? And they're like, "You mean menopause?" I'd be like, "No, menopause isn't the problem." Like, nobody's gonna complain about not bleeding anymore, especially if they haven't bled for a year. It's the ovarian failure that's the result. That's the problem. So, yeah, so we don't get training in that, right? But we sure get training on the script pad and the hand on the door and giving you less than 5 minutes. So then how do you treat it? I only use a tiny dot of bioidentical progesterone. Margaret said only a tiny dot. Yeah, and everybody's different. So, most of the time we dose the bioidentical progesterone creams in about 75 to 150 milligrams. And then testosterone for women, we usually dose that at about 10 to 20 milligrams. And so topically, it absorbs really well. So testosterone is something that a lot of doctors forget with women, but I certainly wouldn't do. I wouldn't do like 800 milligrams of progesterone or testosterone pellets and start growing a beard and all that kind of stuff. So, oh, and Margaret, yeah, I agree with you. I I let my patients self-adjust because it's okay. If you listen to your body, I love it when women listen to their body and they know what's going on with them because like I even have some women with thyroid that will regulate their dose based on how they're feeling and that's almost like blasphemy, in the medical world to say you would let a patient, you know, within certain bounds like right, but you would let a patient like figure out their own medicine. And it's like, well, we have a conversation and I let them know what to look for. And, we do check labs. And Missy said, afraid of pills. Yeah, pills with estrogen, when it goes through the liver, the way it absorbs is it breaks down metabolites. And I talk a lot about the different types of estrogen. And Margaret says it's been keeping me saying, yeah. So Margaret, one thing you might want to think about if you're just doing the progesterone would be, come visit with us and maybe add some testosterone if you're not already. So there's a whole lot more that you can do. Missy said it made me crazy. Which made you crazy, Missy? Was it the pills? Because yeah, when you take in the oral route, how do we visit? Yeah, you just go to hormonebliss.com and we start with a test kit because we want to know where you're at. And even if you've had labs, then we want to make sure that we have that baseline before our experts talk to you. So just go to hormonebliss.com and we can help you. Missy said, oh, estradiol made her crazy. So yeah, some people, if they don't get the estradiol, or there's different kinds of estrogen, right? Estradiol is just one of them. So if they don't get the estradiol dose dialed in, you will feel crazy because that's what happens when you have a menstrual cycle is right before the menstrual cycle, you have a surge of estrogen, which we call estrogen dominance. And then if you don't have progesterone to balance it out, that estrogen dominance makes you feel crazy. And that's what PMS is when you have too much estrogen and that progesterone hasn't kicked in to sort of tell it to chill out. And so, yeah, I totally get that. If it's not done right, estrogen can be very, very problematic. And I would say stay the course to try to find a dose of progesterone or a dose of estrogen that or estradiol or whichever estrogen you're picking. That's I need to break that down into different estrogens because I'm rambling because I'm like, okay, I'm trying to get in my head how to convey the different kinds of estrogen and the difference. But if you use the protective estrogens, you can still get the good effects for your bone and your brain and your heart, the protective effects, without the problematic estrogen. So I'm going to have to draw a picture about the different estrogens to kind of explain that, because I know I'm not making any sense, because I'm hearing it coming out of my head and it's not making sense. But I do want to still address, because I don't think I did. Someone said that they're 46, perimenopause, what's going on? And one of the interesting things that you can do with perimenopause, if you're really curious because you're still having periods, is first of all, ask yourself if you feel like crap, if you have frozen shoulder, if you have joint pain, all the things, if you're not sleeping, then yeah, you're there. And then people always want to know, am I in menopause? The definition of menopause is a year without periods. So if you haven't gone a year without periods, you aren't technically experiencing or experienced menopause. But that doesn't matter. I keep saying that. Having periods or not having periods does not matter. When you go into ovarian failure, this is what you're dealing with. This is the problem. And when you are starting into ovarian failure, this is a really bad time, and people feel like crap, and no one will listen to them because you're still having periods. And you'll say, am I menopausal? Because the limited information that we have, and they'll say, am I menopausal? And then they'll go to the doctor, and the doctor will say, well, when was the last time you had a period? And they'll say, yesterday, and the day before, and the day before. And it's been a solid period for 3 months. I mean, that's not funny, but that's what they say. And they're like, oh, well, you can't be in menopause. So come back in a year when you've stopped having periods. And that's what we're told. Or here's your antidepressant, or here's your sleeping pill because you don't have any progesterone anymore. And so, yeah, what are we supposed to do with that, right? So I'm so glad that progesterone is helping. And I have a lady who's been my patient for probably 8, 9 years. And she, when she first started coming to me, she was having horrible, horrible migraines. And she was estrogen dominant all the time, felt like she was in PMS all the time. And we basically have treated her with progesterone cream all this time. And, it was a lifesaver for her because she had debilitating migraines. Let's see, K8 Maddie says, yes, I almost lost my mind going into that phase of my ovary shriveling. It is crazy. And I'm telling you, I'm 55. Whenever I check my blood work, if I don't take my hormones, which nobody in my family, trust me, wants me to not take my hormones because I'm like so dependent. When my ovaries failed, everything failed. So yeah, my levels are 0 if I don't take my hormones. So yeah, it's a big deal. What about period symptoms, bleeding but no bleeding at 42? Okay, well, sometimes what happens is people's, oh, okay, you guys are going a little fast for me. So if I don't answer, please come back and ask again. She said, I had peri symptoms at 39 and had cycles until 45. So yeah, all this erratic stuff is what happens. And you can still have periods. And I mean, they'll stretch, and then they'll be longer, and then they'll be harder, and they'll be heavier. So I'm going to draw a little graph here. And please, you guys, when you're asking questions, things will get bumped too. So please, please, please bring it back around. Ask me as many times as you want until I see your comment and respond to you, because I love you all and I want to respond. And we're only at half the hour now, so I have plenty of time. So please, please, please come back around. Okay, so I'm going to draw a graph here on top of this. And this is 28 days. And this is what usually a menstrual cycle is, unless you're all over the place, right? So a menstrual cycle is usually 28 days. And then middle is day 14, which is when you ovulate or you pop out an egg. And if that egg gets fertilized, you make a baby. And if you don't, then that lining, that bloody lining just sloughs off. Yeah, it's so like unpredictable when people will go through menopause. There's a genetic component. Sometimes people will say, ask you when your mom went through it or grandma went through it. So anyway, 28 days for a menstrual cycle. And again, I'm going to put hormones on this axis. And so what happens is the first part of that cycle, estrogen climbs. And then about day 14, when an egg pops out, then this is still climbing here. This is estrogen. Remember, I did estrogen in red here. Then progesterone there's a feedback hormone with the brain, and progesterone comes on and grabs onto the estrogen and sort of pulls it down. That's kind of a simplistic reality of what I'm trying to say. But if progesterone is too low, progesterone deficiency, which is where estrogen dominance comes in, and it hasn't been able to grab onto the estrogen, and the estrogen keeps climbing, we call that estrogen dominance. And then you can have so many symptoms there, which is what kind of this craziness is. And this can get worse with perimenopause. This is what causes endometriosis. This is what causes PCOS. This is what causes fibroids. This is what causes dysfunctional uterine bleeding. Sunny Sky said, my GP didn't believe in HRT, so I suffered for years until I fired him. Good. I'm glad you fired him because this is your life. And doctors are not gods. Doctors are not the end all be all. If one's not listening to you, he's a jerk and move on, right? Or she. I mean, there's plenty of women doctors who don't believe like Santa Claus in hormones. I mean, it's just like, it's crazy. I mean, just put it all in the bucket of hormones, right? Okay, so back to this. If estrogen continues in its dominance and you're building up this red bloody lining, it causes all sorts of trouble. What happens is the next month around, when the feedback hormone to the brain says it's time to ovulate again, it gets confused. And so now if we stretch this out to 3 months, now this is off every time. So this is when you start getting irregular bleeding and the days are off and the amount is off. And this month you'll get a lot. And with all that change, estrogen affects your mood on so many levels. So does progesterone. But I mean, like if you're estrogen dominant, you feel like you're in PMS all the time. And I just had a patient, I think I talked about this last night, but I just had a patient this past week who we were having a little trouble getting her balanced. And when we checked her labs from the last lab, she was still very estrogen dominant. And I was so consistent with her symptoms because she's like, I feel like I'm in PMS all the time. She's like, I'm sleeping better, which she was getting her progesterone up, but she was still estrogen dominant. So we had to work with that. But like I say, we always get people feeling better if you're just willing to have faith and go the course. I'm using progesterone first 10 days of every month. Yes, and I do that a lot. I do cycle progesterone if people are still having periods. And I'll draw that out here too, just to help people who don't know what that is understand that a little bit better. So in a menstrual cycle, I'm going to kind of go back here and I'm going to draw this back to 28 days here. It's getting a little messy here. But around this part of the cycle, when estrogen's going crazy, you can give somebody cycle progesterone during this time. Draw it like this. And you can calm down that estrogen peak and really help with PMS symptoms. And if you have anybody who's struggling with fertility, I do this. I have a whole fertility program, natural fertility program. And I've had women who have failed in vitro fertilization multiple times. Just do this. And there's a couple other things. We do an anti-inflammatory diet and methylated supplements, and we clean up the liver a little bit. But it's nuts. And it's within 3 months. Within 3 cycles, they'll get pregnant. So I always warn people that if you're going to do cycle progesterone and you're still fertile years, be careful because it actually will increase your fertility. So, okay. So I know I missed a bunch of questions because you guys got all sending me stuff you wanted to know about. So please bring those questions back around. But I'm just going to kind of jump into joint pain because I said that's what I would talk about tonight. So as long as I'm kind of waiting around to answer your questions, I'll talk about joint pain. So why does joint pain happen after menopause? And it's interesting because almost 99%, no, that's not fair. I don't know, a lot. I think there was a study done of 1,000 women, and I think it was 89% or something like that. A frozen shoulder happens in women between the age of 42 and 55. So, I mean, that's significant. And why people aren't like saying, hey, wait a minute, what's going on here? So what frozen shoulder is basically it's inflammation in the capsule of the shoulder. My screen's flipped here, so it's a little weird. Inflammation in the capsule of the shoulder. So Alabama says happened to me. Yeah, it's super common in menopause, and nobody ever says, "Oh, that's because you need hormones." That's because your hormones are going crazy, or they're declining, or you're an ovarian failure. And the estrogen helps the blood flow to the capsule, right? Because you have to have blood flow in there for everything to work. And then the progesterone works as a anti-inflammatory. Okay, so this is exciting because I'm going to jump right into. You guys asked me about estrogen. Um, and we were talking about the different kinds of estrogen. So your body takes cholesterol and it turns into estrogen. Who knew, right? Everybody thought it was just a fatty globule ready to cause a heart attack. And then estrogen turns into testosterone. And all these can flip back and forth. And then estrogen also can flip into progesterone. And there's DHEA and pregnenolone and a whole bunch of other hormones too. But there are different kinds of estrogens, and I say estrogens. So if you're on bioidentical estrogen, you can use what's called E3 or estriol, and it's a really mild form of estrogen. So even if you had trouble with estradiol, which is the sort of mid estrogen, if you will, but it's great for bones and great for heart and great for any other symptoms like hot flushes and joint pain and all that stuff, and neuropathy. But if you're concerned or you haven't found somebody who can dose estradiol right for you, you can always take E3. And E3 is not the strongest of the estrogens, but it can give you a lot of protective benefit. And the reason it gives you protective benefit is there are two other estrogens called E1 and E2. And E2 is estradiol. We just talked about that. But E1 is estrone. Oh my gosh, I just messed up. I'm so sorry. Estrone is the bad guy. E3 is the protective. Yeah, I said that right. And so E3 actually will bind up the receptors on the estrone and protect you. So I would say if you are at risk for any breast disease of any kind, you should at least be on E3 because of the protective effects. And I will go head to head in a debate with any doctor who wants to debate that with me because the mechanism of action of the protection of E3 is not debatable. I mean, and so doctors who don't do the research and don't study it, like doctors who are well versed in ovarian failure, um, I'll go up against anybody and have this conversation because I have the research to back it up and I have the straight up science and physiology to back it up. So I have no problem saying what I'm saying. But you know what? My ego doesn't get in the way of this. This is facts. This is nerdy science. And I want people to tell me. I am always open to things. Prove me wrong. I'm always open. I want to have the conversation. I'm not the person to just say, I'm right and everybody else is wrong. And I can't believe they're so bad. I'm saying that because women are suffering. And if women weren't suffering, I'd keep my mouth shut and I'd be like, okay, well, they can believe like Santa Claus, whatever they want to believe. But this is science. And so I always tell you guys, do your research, study this, make sure that this crazy blonde in here up here ranting and raving about women suffering and ovarian failure, make sure that I'm telling you the truth. And if I'm not, tell me, DM me, like comment, tell me. I mean, I'm always open to stuff, but I'll always tell you that I would never present to you data or science that is not legit because I love you and I love me and I love my patients. And you could ask any of my patients, the love that I have for them because I'm trying to help people feel better. That's my mission. And so to dismiss you or to gaslight you about what you're feeling and not to address the underlying cause is just not cool. So when I tell you this stuff, like please look it up and please make sure that it resonates for you. And I think that's part of the problem is that people don't question their doctors. So I'm just like them. Question me. If there's a problem, or you have question me. And, I always say, I don't know everything, but I can find the answers. And I think that's why I like the nerdy science. I call it investigational medicine. That's why I love it, because I am not afraid to do the research, and it is time consuming, but it's so cool. And I get really super jazzed about helping people when no one else will. I had a patient tell me the other day, she's like, we're diagnosing her autoimmune stuff. And she was like, um, why are you doing all this for me? Why are you trying to help me figure out all this out? We have her on hormones and she's doing much better, but there's still some weird lupus kidney stuff going on. And I'm like, well, honestly, because I don't think anybody else will. And she said, yeah, I know nobody else will. So, it's just sad. It's sad that that's the way medicine is. Um, Barbie says, I thought I just hurt my shoulder, realized that this is probably what I have because it didn't stop. Yeah. And the inflammation can go on for like 2 years if you don't do something about it. Um, so let's talk about frozen shoulder a little bit and joints. So a couple things that you can do. I love hyaluronic. Of course, get on some BHRT. I mean, that's a no-brainer, because I don't think your shoulder is going to get better till you address the underlying hormone issue, because the inflammation is just going to stay there. I mean, you go on steroids and get shots and stuff like that, but that's not going to fix anything, right? It might make you feel better, or pain pills or whatever. We do something in our office called PRP or PRF, where we draw your blood and spin it down to the platelets and the stem cells and the fibrin. And it has amazing, I'm going to take a drink of water, so I'm getting hoarse talking too much. Amazing effects. I've been doing that procedure probably going on almost 15 years now, and it is nuts. It'll heal your frozen shoulder. So if it's so bad, I would ask for PRP or PRF. See if anybody in your area is doing it. Do not get steroids. It will break the joint down even more, because steroids are synthetic cortisol. Oh, I was going to draw that on here too real quick. So this side pathway of hormones is cortisol, which if you've ever had a cortisone shot, this is your body's natural anti-inflammatory cortisol, which this word sterol and cholesterol, that's steroid. So these are all steroid hormones. So like when you get a steroid shot, that's cortisol. And so if you don't have these hormones here and you don't have cortisol, you're not going to be able to battle your body's inflammation, right? Progesterone is a natural anti-inflammatory as well. But part of the problem is if you have too much cortisol, you get belly fat. You don't have enough cortisol, you're going to have joint pain. So it really is a balancing act with all these hormones. But if your ovaries have failed and you don't have any of this, if you don't do this, if you don't give your body the support that it needs, then you're going to continue to struggle. There are exercises. We have something in our office called Shockwave, and it's ultrasound technology that can break down the scar tissue in frozen shoulder or any joint pain really that's not healing well. And then I love collagen powder. So this is our collagen powder, and you can get this on Shop Hormone Bliss. And if my lovely moderator, my fiance, who I love more than life itself, would put a link there, you guys can find that. So I like our special formula stuff. Is like, I'm a nerdy scientist, and I love stuff. I take a ton of supplements. Ooh, that's kind of hard to hold that there. Can you see it? But I love this one because it's got 5 different kinds of collagen in it, peptides, all the things in there. And then this is like my favorite thing. I don't know if you can see this, called Joint Ease. And this is our private label proprietary blend. And this is nuts. We can't even keep this on the shelves. I keep having to restock it like all the time. And it is hyaluronic acid is the main thing. So hyaluronic acid is that the joint space stuff that acts like cushion in joints. So whether that's your knee or your shoulder. And it's got also glucosamine and MSM, turmeric, all the things that, you kind of associate with anti-inflammatories. So, I mean, it's nuts. So if you want to give that a try, that's on our site, Shop Hormone Bliss. So you have to type in the shop first, Hormone Bliss. And we also have a ton of other stuff on there, protein powders and all the things. So you can go check that out. Elaine says, Boswellia, frankincense, European studies is good for joints and GI inflammation. I have not studied those, but I'm going to. In fact, let me take a screenshot. So I'll remember to go back and look. Okay, cool. So I'll go back and look at that, Elaine. Thank you for sharing that. Um, I know we're getting down to the hour. It's almost 8 o'clock. I can't believe it. I love you guys. I love hanging out. Um, can PRP therapy treat knee and hip arthritis? Yes, 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 and yes, and yes. I do it almost every day in my practice. It's amazing. It is all you. So there's no artificial anything. There's no steroids in it, no synthetic steroids, nothing. So it's what happens is I'll do a quick little thing here. If you can see this, okay. So this is a test tube basically. So we draw your blood and put your blood in here. And so this is the blood. Okay. So what we do is we spin that down. And when we spin that down, what we're left with is the red blood cells are all down here. And then what separates out are the platelets, and platelets are anti-inflammatories as well, and stem cells, which come from your bone marrow, that then can become anything, can be joint space, nerves, blood vessels. It's nuts. I love PRP. We do PRF because now it's a little nerdy science. We use new technology equipment that does what's called a horizontal spin instead of a vertical spin. So we can get more of the red blood cells out of the way and get more of the stem cells and platelets and fibrin, the anti-inflammatory factors out of your blood. So when we inject it, we get a lot more powerful effect from not just injecting a bunch of red blood cells, but we get all the other good stuff. So how long PRP usually works? 1 month or 3 months? Sometimes over the years, and like I say, I've been doing it for over a decade. Sometimes it's one and done. I've had a lot of people that have never had to come back. And then I have people who are super active and keep injuring themselves. And, they'll come in like twice a year but a lot of times when they've had arthritis for a while or had hormone issues for a while, they have multiple joints that are hurting. So it's hard to draw enough blood to do multiple joints. So we'll spread that out. So it looks like they're coming in often, but it's really just because they have several joints that are hurting. But especially if you have just frozen shoulder, it is amazing for that. And don't let people put you on synthetic steroids, because just like synthetic estrogen has so many side effects, puffiness, weight gain, fluid retention, all the things. So if a doctor is just trying to throw a steroid shot, pain pills, or ibuprofen, which tears up your stomach and decreases your platelets, which is the last thing you want to do, then yeah. Barbie says, what is PRP? It stands for platelet-rich plasma. So the plasma is part of the blood that we're spinning down, and the platelets actually are the little things that when you cut yourself actually create that wall to keep you from bleeding out. And so the platelets can actually heal that wall basically. So platelet-rich plasma, but we do PRF instead of PRP, which is platelet-rich fibrin, because our goal is with that horizontal spin to get more fibrin. And what is fibrin? That is the stuff that actually has the healing matrix and the chemotactic factors, meaning the chemicals that tell your body to come and heal that area. So GT says, is there still a cancer risk with BHRT? Okay, so we're on the hour, GT, and I so want to get to that. I'm here every night at 7, so please come back tomorrow because I absolutely want to answer that. On my profile, I have tons of videos, so please go look at those, because if I start that, anybody who knows me knows I'll be on here another hour, and my moderator's like, oh, I'm tired, get off now. And forgot progesterone. Oh, yeah, so love my granddaughter. Yeah, please come back tomorrow night at 7, please, because I want to answer these questions, and ask me them again, because I'll have slept since then and I might not remember. So please come back, because there's so much more to this, and I want to tell you about the safety, and I want to tell you the risks and concerns as well. Lane says, have a wonderful evening, you too, sweetheart. And Barbie says, thank you. Oh, you're so welcome. And thank you for being here. I love you guys so much. And again, we're running our special for our test kits for December for Christmas, your little Christmas present. So get a present for any woman in your life that you think could use some help with her hormones. And we so want to help. I so want to serve. Sunny Skies, you're fantastic. You're fantastic. Thank you, honey. I appreciate you for being here. You have no idea. It really feeds my soul that you guys are here listening, and most of all that you like listen to my nerdy science, because like I love it. I always draw pictures of all my patients every day, so I love doing it, but we have to get the word out. Women are suffering and it has to stop. And that starts with you and me and you guys going out and saying, this is not menopause or perimenopause we're dealing with. This is hormone imbalance and ovarian failure, and it has to stop. So, okay. So here I go, guys. I love you very much, and I'll see you tomorrow.